Hi, my name is Michelle Henry. I'm with the University of Texas at Arlington School of Nursing, and today I will be lecturing on osteoporosis and the associated medications. Osteoporosis in postmenopausal women causes their bones to become weak and brittle, causing fractures in the hip, spine, or wrist. Approximately 1.5 million fractures a year are caused by osteoporosis in the United States, and this can lead to chronic pain or poor quality of life. After a woman reaches menopause, estrogen levels decline, putting them at a high risk for decreased bone mineral density and fragility. Usually there are no symptoms in early bone loss, but however, as the disease progresses, a woman may notice signs of decreased height, back pain, or possibly a fracture that happened way too easily. To understand osteoporosis, let's talk about how this happens in the body. As we grow, our bones are in a constant state of renewal, of building and breaking down of bone. This normal physiology is called bone remodeling, where the body uses osteoclasts to break down bone through reabsorption and osteoblasts to build new bone through mineralization deposits. Osteoporosis occurs when this homeostasis is altered, and resorption happens faster than the building of new bone, leading to decreased bone density and fragility. After menopause, the estrogen excreted by the ovaries declines, resulting in decreased bone matrix and decreased calcium and phosphate in the bones. There are two medications that I'd like to talk about today, and they are both biphosphonates. And the first one is alendronate, which is also Fosamax, and the second one is zoldronic acid, which is Reclast. These are both the first choice of medication therapies for osteoporosis. Their mode of action is to inhibit osteoclast activity of resorption, thereby stopping the breaking down of bone and allowing osteoblasts more time to build bone. The expected outcome is to prevent further bone breakdown and to promote bone remodeling. Fosamax is an oral medication that's given daily or weekly every morning with 6 to 8 ounces of water on an empty stomach. The patient must also sit upright for 30 minutes to optimize the benefits and decrease the GI side effects of nausea, dyspepsia, or abdominal pain. Reclast is an IV medication given yearly and then afterwards every 2 years. The possible side effects of this are infusion reactions such as fever, flu-like symptoms, or local injection site reactions. Both of these medications are safe and have been approved by the FDA. However, there are two major side effects to be concerned with. The first one is an atypical femur fracture, and the second one is osteonecrosis of the jaw. These medications have proven effective, and with Fosamax, it has shown to reduce spine and hip fractures by about 50% and non-spine fractures by 20%. Reclast decreases spine fractures by 70%, hip fractures by 41%, and non-spine fractures by 25%. Both of these drugs have interactions, and for Fosamax should not be given with calcium, antacids, or iron because it will interfere with absorption, and it should also not be given with aspirin or NSAIDs because this could also lead to GI upset. Reclast should not be given with loop diuretics or aminoglycosides due to an increased risk of hypocalcemia, as well as other nephrotoxic drugs such as NSAIDs or medications that are excreted by the kidneys because it has been associated with reduced kidney function. The cost for Fosamax is about $130 a year, and Reclast is about $196 a year. Prevention modification of lifestyle includes strategies to prevent fractures, such as resistant and weight-bearing exercises, consumption of vitamin D and calcium, and altering lifestyle choices. Women can deter fractures by decreasing their fall risk by doing a fall assessment, incorporating exercise such as yoga or Tai Chi to improve balance, and decreasing psychotropic medications and alcoholic intake. Once a woman is diagnosed with osteoporosis, she can take these medications to increase her bone density and to reduce the risk of fractures. This concludes the lecture today. Thank you so much for watching.